If you or your child or your family member or coworker has been sick for a while, what do you encourage them to do? Most of us would eventually say, I think you need to go see the doctor. And maybe that's going to urgent care, going to their primary care provider, or in severe cases, going to the emergency room. But what if you had to pay for that completely out of pocket because you didn't have the resources that could help you? PBS said 1/3 of the United States does not have a primary care provider and is not seen by a medical professional on a regular basis. 40% of adults in the US are delaying healthcare issues because of the financial costs. These costs can include receiving labs, having the labs resulted, getting imaging completed, paying for the doctor's time, medications, and other medically necessary things. The United States is a high-income country. The United States needs to make healthcare a basic human right and not a luxury. I've worked in healthcare for a little over 2 years now, and I'm currently enrolled in school in hopes of becoming a medical social worker in the emergency room. I've seen firsthand how finances have come before patient health time and time again. What if there is a solution to this problem? Today we'll be discussing what healthcare looks like on a global scale. We'll then discuss one of the biggest arguments against universal healthcare, and lastly we'll look at the overall benefits of healthcare for all. Let's look at what healthcare looks like across the world. The United States is classified as a high-income country. The World Bank Organization also classifies the United Kingdom, Canada, New Zealand, Qatar, and many other countries as high-income. But when you look at the list, the United States stands out because it's the only country on the high-income list that does not have some kind of universal health care. It's also noted that in 2023, the United States has the lowest life expectancy. They also have the highest maternal and infant mortality rate and the highest death rate of treatable conditions on the entire high-income country list. One of the concerns people have for universal health care is that what would happen to the private insurance companies? Private insurance is the insurance that you and I get from our jobs. That includes Anthem, Aetna, or United Healthcare. When we look at a country like Germany, we see that they do have those private insurance companies in place, but they also have public insurance available or government-funded insurance for people who are low income, the elderly, people who are disabled, or for families. Now that we can see that it can be done, let's look at one of the biggest arguments against it, which is the cost. With things like Medicaid and Medicare, which I want to make clear is not universal health care or health care for all, that's just health care for some, as well as private insurance. The United States spends about $11,912 per person a year on healthcare costs. A place like Germany or South Korea that has some kind of universal healthcare system that could be implicated in the United States, they spend $7,000 per person and $3,900 per person. But what would the cost look like for you and I? Mentioning Germany again, and to reiterate, this is because their healthcare system could be easily implicated into the United States. Germans spend about 14.6% of their yearly salary on taxes. And this is taxes altogether, not just taxes for healthcare and universal healthcare. In the United States, the Social Security Department says the average salary is about $66,622 a year. Someone who makes that much and files their taxes as an individual is federally taxed 22%. So we already see that the cost for us couldn't increase anymore because we're already paying higher than countries with universal health care. And finally, as we've established, 40% of Americans do not get the health care that they need. But if they do, what would be the benefits? It's obvious, but it does need to be said. The more often you and I go to the doctor, the earlier our illnesses can get caught or our diseases can get caught and then get treated. This then leads to less medical emergencies in the future. And when we look at the big picture, that would end up making the United States a much healthier country, which we know out of all of the high-income countries, we are ranked lowest in terms of healthiness. We can also come to the conclusion that when people are seen by a medical professional more regularly, they're less often to get sick. This then can help them get more productive at work, help them miss less work, and go shopping, be out and about in the world, and that ends up putting money back into the economy. And lastly, catching treatable illnesses early on can help prevent a lifetime of medical debt. In total, Americans owe at least $220 billion in medical debt. Today we discussed what healthcare for all can look like on a global scale. We also discussed why healthcare is not as expensive as we think it is. And finally, we discussed healthcare for all benefits overall. As a high-income country, the United States needs to implicate health insurance as a basic human right and not a luxury. Thank you for your time, and I hope that I provided some clarity on a very multifaceted topic, as well as help you see why the United States needs to implicate healthcare for all.